bonding conversation, believe it or not. And Glenn, did you realize, oh, he's on the phone. I can't give him a hard time. Years ago, Senator Utke, Senator Newman and I had a conversation about some trail between New Germany and Lester Prairie, right? And Newman, of course, he would say, you put the trail up, you better put he wanted a license, it's something you could pay as you go kind of thing, right? So Glenn, just to let you know, I'm late because I was having a bonding conversation and I asked if we could turn our trail between Leicester and New Germany into a 4-lane expressway. What do you think? Yeah, you in? Thank you, members, everybody. We have a packed agenda today, so I want to remind testifiers, when folks are talking, if you could please confine, your remarks to no more than 2 minutes, and that would be helpful to everybody, I think. Our first one is Elise Bailey, Christy Grom, Paul Verrett, Chris Westergaard are coming down to talk about Senate File 5042, and that is we as a committee are looking at the governor's DHS budget proposal. And so I'm going to let Ms. Bailey and Ms. Grom take us through the bill. There is an A1 amendment, if members could allow the A1 amendment to go on so that Ms. Bailey and Ms. Grom can tell us what we like and what we don't like. I'm kidding. All those in favor of the A1 say aye. Aye, opposed, same sign. Thank you. It is there. Ms. Grom, you got everything hooked up there? Oh, it's Miss Bailey. I don't have my glasses on. And I'm still so excited to turn Glenn Grunhagen's 2-lane trail into a 4-lane expressway between Lester Prairie and New Germany. So, my wife was right. I'm not funny. I won't try to be funny. So, it's funny. And well, it was an old bill. Glenn and I got Scott Newman, who was a senator, didn't like to do trails because he thought trails should be, people should have a pay slot as pay as you go. You want, yes, he did like trails because it was, and so I did one for then at the time, he was in the other body, just like you were in the other body. You Representative Grunhagen and I did a bill to connect Lester Prairie, New Germany. And so I was trying to be funny saying I was in a bonding. While I was late, I was in a bonding committee talking about turning that into a 4-lane expressway. See, now you're laughing. Content does matter. So, and we're waiting for Miss Bailey to go. We had asked Elise Bailey and Christy Grom to go through what the governor's budget proposal is about. And that is basically for us, as we have our own responses to budget proposals. And so, and especially as a supplemental budget discussion. So with that, Miss Bailey, whenever you're ready. And where's Miss Grom? Is she? You're not coming down.
Miss Grom's drafting her TA.
Is she? So I can't do the Price is Right guy and say, come on down. I don't know. What do you think? Don Shelby, you want to come up here and moderate? Go ahead, Ms. Bailey, whenever you're ready.
All right. Thank you, Chair Hoffman. Members, Elise Bailey, Budget Director of the Department of Human Services. Today, I'm just going to briefly breeze through what is in the governor's supplemental budget.
So real question for you. Would you want to go through everything and then take questions afterwards? Because I know Paul is here, and then we also have Chris on Zoom. What's your preference? You want to just go through everything and then, or do you want to take questions as we go?
Chair, it's up to you. I am agnostic.
Okay. Members, do you want to just wait till the end or stop? Stop as it goes? All right. If it's germane to the conversation. Correct. Thank you. Then we will just be flexible. Thank you, Ms. Bailey.
All right. Thank you, Senator Hoffman and members. So this first slide goes over the pillars within the governor's budget this year. This year, we have centered our budget around thinking about how we can transform the human services system to work better for people. We have proposals around responding to federal action. We have a significant package around strengthening our program integrity controls across the programs. We have a few proposals on targeted investments that I'll go over. And then lastly, we have some proposals on curbing spending growth. The next slide goes over across jurisdictions what the totals of our budget land to be. We have around 35 proposals across those different categories that add up to about 240 million in savings in this biennium and 489 in the tails. Again, that's across jurisdictions, so not just in this committee, but a lot of it does land here. Okay, diving into the first category of transforming the human services system. You know, we are at a place in Minnesota where we know that the system is really challenging for people to navigate, and particularly with your committee, you know, we grapple with that every day we're in this committee, hearing about how the system is just too complex and it's challenging for people to get the services that meet their needs. We also know that complexity has grown over time, and it's made it difficult not only for people to navigate the system and getting access to the services, but it's also difficult to administer within the current framework. That complexity, adding and adding and adding over time, or modifying and modifying and modifying over time without taking a step back and thinking about how we would really structure the system if we were to build it today, has made it really challenging for our counties, our tribes, and the state to administer the programs. Another driving challenge that we have is disinvestment and underinvestment in the administrative resources of administering the core functions of our programs. This is both on a state level. You know, DHS has 2 to 3% of our budget spent on administrative costs. That means all of the systems, the eligibility systems, the claims systems that supports over 1 million Minnesotans across the state, as well as all of the staff that we have at the agency. That amount is much lower than really any other nonprofit or healthcare industry entity, and it has occurred over time, the disinvestment in administrative resources. Of course, that also is the case at the county level. Where because we've had added complexity and tasks to the counties, they also have had challenges keeping up with the demand of having to fund the administrative resources to do the duties and responsibilities that they're in charge of doing for the Human Services Program. One thing we really don't know is how much it should cost to administer human services in our state, and so that's one key question we would like to answer. Another key problem we're seeking to solve is we have a hybrid system where we have about 45% of our program or our spending spent on managed care and the rest of it in fee-for-service. And it has resulted in a siloed approach to program integrity where we have 8 managed care organizations, we have the state doing program integrity work, and we don't have a holistic perspective across the state. It also mitigates our ability to mitigate financial risk. And then lastly, decentralization of roles has resulted in different policies, procedures, rules for the person receiving services across the state. And those rules, procedures, and policies could depend on where you live, who operates your benefit, who your worker is. And so we're really seeking to streamline the program so that it really works best for people and that it's transparent and understandable. So this proposal is found on in our budget book on page 3. It has multiple components on ideas that we have to transform the human services system, and I'll go over each one in detail. This one is in Senator Wickland's committee in the Healthcare Committee, but I'll just briefly go over it. Again, 45% of spending is paid for through managed care, where MCOs set their own rates, provider network, prior authorization and billing requirements, and their program integrity processes. With our proposal, we're really seeking to make sure that people have access to the same provider network, the same rules, the same processes, to eliminate complexity and access barriers for people. We also want to take back policy decisions to the state and the legislature to oversee the Medicaid program. And so we can better influence spending and mitigate financial risk. And we want to better incorporate program integrity processes that go across the whole program rather than in siloed approaches. So our proposal would shift to an administrative service model beginning January 1st, 2029, where that ASO would be responsible for the administrative functions for processing healthcare claims, where the state would maintain all the policy decision-making. The next item is shifting some MA eligibility functions. So Minnesota, of course, is one of 10 states where we have a state-supervised, county-administered human services system. Counties and some tribal nations are responsible for determining a person's eligibility for Medicaid. And there are some challenges in that, as I mentioned earlier, there's increased complexity in that. We have aging systems that counties are forced with doing manual workarounds. They have large caseloads, and as you'll see, well, probably not in this deck, but in HR 1 provisions that we have elsewhere in our budget, there's federal mandate, unfunded federal mandates. What we want to do in this proposal is to transition some of the manual type functions that counties currently process in the eligibility space to the state beginning July 1st, 2028. Those are things like, you know, the paper applications and programs that have different MA eligibility categories, such as people with breast cancer and cervical cancer eligibility category. The phase 2 of this would be to co-create a long-term strategy with the counties and tribal nations on whether any remaining eligibility functions would move to the state. The third item in this proposal is helping ease the MnChoices assessment backlogs. So another key function that counties and tribal nations and managed care orgs have are to conduct assessments that determine a person's eligibility, functional eligibility, so their eligibility for long-term care. And we do see delays often occurring just because of the large caseloads and resource constraints that counties have. We have assessed the wait time over time, and you can see the dashboard that we have linked in this PowerPoint that currently exceeds the timeline requirement in law and is growing. With this proposal, we're not seeking to take that function from counties, but rather try to assist in those areas where we have a lot of backlogs. So we would create a new team at DHS that would conduct assessments and supplement lead agencies where we're having large backlogs. We would also support counties for a person where the MA is pending, or they're encountering certain systems barriers or don't have case management. These are the kind of key indicators that we would be working with counties on in terms of prioritizing who would we do assessments for on their behalf. Another key element to this is establishing a work group with the counties, tribes to develop long-term solutions to the assessment process. This proposal would enable us to pull more data on what are the key drivers in the backlogs for MnChoices. Another component is reforming waiver case management. So waiver case management is a key and significant service for people. They're responsible for developing a person's support plan and ensuring that their services meet their needs. We do see with this as well is that counties are faced with high caseloads, unclear expectations, high turnover, low reimbursement that hasn't been changed in many years, and increasing levels of acuity and complex conditions that the people they're supporting face. We also know that a lot of counties and MCOs utilize contracted case management, which has resulted in varying enrollee experience and inconsistent oversight and expectations. What our proposal would do is to study, to provide long-term recommendations on what the roles, responsibilities, and oversight requirements of waiver case management should be, along with a new rate methodology to align costs with rates that would be submitted prior to the 2029 legislative session. The second part of this proposal would to phase out contracted case management by July 1st, 2031. With this, we're really seeking to have consistent oversight and expectations, and at the end of the day, improve the experience for people receiving services. We also are seeking to have a rate that adequately finances our local governments for providing this core service. The last part about this proposal is to conduct a long-term study and development of a long-term roadmap on how we would want to build the human services system globally. We would like to do a comprehensive study looking at what the role of the state, counties, and tribal nations should be in our human services programs. The scope of this would be all of the programs administered by DHS, so it would be, of course, Medicaid, but also Minnesota Care, behavioral health, housing programs, or economic assistance programs, and our licensing and oversight functions. We would also pull in some programs administered by DCYF, including their licensing functions, their fraud prevention investigation program, their economic assistance programs, child support, and CCAP. With this, we want to look at, okay, what is the status quo? What are our current roles and responsibilities in the human services program at large? We want to look at how other states administer human services, focusing on the role of local governments versus the state agencies. We also want to look at the financing of human services administration across the state agencies, the counties, and tribal nations. And then lastly, identify recommendations for what would the ideal delegation of duties be between all of our parties, with a goal of having a transparent, accessible, accountable, equitable, and effective system. We would want recommendations to include financing strategies, as well as considering workforce challenges, systems improvements that we would need, and if we were to shift any duties, what the timing and phasing in consideration should be to ensure continuity of care. Okay, moving into program integrity, and I'm trying to go quick because you have other things on your agenda. So our program integrity package, we have around 10 proposals, and within them we have multiple components. And our approach is really kind of thinking about, we need to incorporate strategies into the whole life cycle of Medicaid. So that means vetting providers on the front end. It means designing program integrity controls within the program design. It means having controls prior to payments going out, so after services are provided, but prior to claims being paid, and then having sufficient post-payment review and actions after the fact. So you'll see in our package, we have strategies in all of these lanes. The first proposal is modernizing program and payment integrity safeguards. This proposal is found on page 38 of your book, and this is really intended to adequately put in the functionality into our systems to reduce fraudulent, wasteful, and abusive billing practices in our public health care programs. This would establish a comprehensive prepayment review of claims. It would also establish a comprehensive post-payment review of claims, and it would provide us the ability to do predictive analytics that would allow us to continually inform not only the prepayment review and post-payment review, but also how we design our benefits moving forward. The next proposal is enhancing program integrity and medical assistance. This one has several components within it. The first one is establishing a data-driven risk assessment process. This would allow us to have a more robust process for vetting providers on the front end. The risk assessment would evaluate organizational readiness, financial stability, compliance history, whether the provider has registered with the Secretary of State, and service necessity. The next part of the proposal would enhance provider revalidation processes by shortening the timeline providers must respond to revalidation and potential termination of enrollment from 120 days to 60 days. We also have in this proposal many components that would strengthen accountability for managed care organizations. The thought process with this is having the same kinds of standards for managed care organizations that we have for our fee-for-service program. So this proposal would require MCOs to conduct prepayment review. It would provide funding at DHS to conduct post-payment review to ensure that we have a way to analyze the claims on a holistic perspective. It would require MCOs to publicly publish any of their program integrity actions like we do on the fee-for-service program. It would also require them to implement all claims edits and policies that we require on the fee-for-service side. And then lastly, it adds staffing at DHS to ensure oversight over the MCOs.
Is that, Ms. Bailey, the oversight of the MCOs, is that our jurisdiction or is that Senator Wickland's?
Chair Hoffman, it's probably Senator Wickland's.
Okay.
Yes.
All right, I just am, you're starting to do some crossover, and I was just wondering, and then that one, I was like, you want us to handle MCOs? We could sure do that. No, I'm kidding, but, all right, keep going. Senator Gruenhagen does have a question for you, so Senator Glenn Gruenhagen.
Well, thank you, Mr. Chair. Yeah, thanks for the presentation. Just, according to the information I've received, and correct me if I'm wrong, we got 14 areas that are under investigation for fraud. Are they under the jurisdiction of the MCOs or DHS directly, or are they split, or what's the situation on that?
Good question, Ms. Bailey.
Chair Hoffman, Senator Gruenhagen, they're split. I believe it's about 1/3 of the spending is MCOs and the remainder, that's from memory, though I can get the actual numbers for you, but they're split, and I think it's about 1/3 MCO claims.
So, Mr. Chair?
Senator.
We got allegations of $9 to $19 billion of fraud in this state. And so we're going to empower DHS over everything when what could go wrong is right. I got a lot of hesitancy about that. And then the other thing, just on the county level, the main complaint I get is the computer system. We're using DOS. They can't communicate with each other. It's just a mess.
Cobalt.
And it creates high turnover of employees. People coming out of college don't even know how to work with DOS, okay? And I sat by a couple of years ago, I sat by two social workers trying to keep track of people, and they just showed me how people scam the system and move around. And because it's so inadequate, well, I wouldn't say inadequate as much as it's just old. We're talking about the 90s, I think, or early 2000s. So is there anything in the governor's proposal to address that?
Ms. Bailey.
Chair Hoffman, Senator Gruenhagen, I'm going to go speak to your first statement. I would say the 9 to 18 billion, again, has never been based on any data that I've seen. So I just want to, every time I hear that, I want to clearly articulate that I have never seen any data that substantiates anywhere near that amount. The idea that DHS needs greater capacity to oversight, we absolutely do. We have an administrative budget of 2 to 3%. And that means that when our forecast spending went up and we're paying more claims and we have more people that we're serving, but you're not giving the state agency adequate resources to have oversight over it, that is a key indicator of why some of these challenges have occurred. We need the tools, meaning staffing and resources, to adequately provide oversight over the system. The other thing is when we have delegated roles and responsibilities with multiple parties, decentralizing functions actually increases risk. So that's kind of why we went to the drawing board in terms of how would we envision the system today. And we have good strategies in this budget that can shore up the program integrity issues that we're seeing. But one key thing is we do need the resources to do it. On systems, in a different jurisdiction than the children and families, and I think that's in Wickland's jurisdiction, we do have a governor's proposal on updating Maxis. And with that, it's funding to update Maxis, and it also has funding to have a long-term roadmap on all of our eligibility programs. So we would like to work on what the strategy could be if we had one central front door for all the human services eligibility programs, rather than replacing systems one for one, keep coming back for this system and then that system. We want to have a global strategy across the whole system. So that's the approach we're thinking right now.
That's I think Torkelson was talking about that, Glenn, the green screens. That's that's a different jurisdiction. So one more within our jurisdiction, and then I'm going to Udke. Is that cool?
Okay. Info I've received is that as far as the computer update, there's 200 million set aside to update the program. I don't know where it's at, but hopefully it hasn't been lost to fraud. Anyway, I'll just throw that out there. The last thing, you know, you questioned the fraud thing, but how many illegals are on Medicaid? Do you know?
And Glenn, Senator Grenade, please, can we, when we dehumanize,
Well, it's not the
Stop.
dehumanizing.
I was shot 9 times because I was dehumanized. I was shot 9 times because we allowed somebody to dehumanize human beings. I almost died twice, Glenn.
Yeah.
So I ask you once, please, do not say illegal in this committee because it dehumanizes an individual. And that's all I'm asking you from my heart.
Okay.
Thank you. Senator Utke.
Thank you, Mr. Chair. And the question for Ms. Bailey, and this isn't, you just happen to be the messenger sitting at the desk today, so nothing personal, but you've mentioned staffing a couple times. And over the numbers of years that I've sat around this table, we have approved a lot of FTEs and a lot of money that goes with those. Is it really a staffing problem that's been appropriated, or is it just a hiring process that you're no different than anybody else and you just haven't been able to hire the people that you would like?
that is one of the best questions. Thank you, Senator Utke, because yes, when you were chair, when Abeler was chair, it was, we increased staffing, and then when we, in 23, we increased more because of that issue, and then the question is that staffing there? What's the bottleneck that's happening for that? So that's a great question. Do you happen to know? And if you don't, we can maybe get somebody from MMB here that could have a conversation. I don't know.
Yeah, Chair Hoffman, Senator Uckey, I would say it's both and. We absolutely need more human beings to do the work. When our forecast goes up over time, those dollars are in one bucket and admin is in another, and we can't cross them both, which for good reason, you know, but it doesn't keep pace. And we're at a point where, you know, when you have a 2% administrative budget, you cannot keep pace with all of the duties you need to do. So it is a dollar, like aggregate amount, but I would say it's also hiring. It is a hiring problem. We don't have the salaries and competitiveness with other entities. So it is challenging, speaking for myself, as trying to hire folks. The state salaries aren't up to pace with other competing jobs. So that is a challenge.
Senator Rodkey.
Thank you, Mr. Chair, and thank you, Ms. Bailey. And I think that's part of it. Like everybody, whether you're in private business or trying to run a lot of the places that we've got people here in attendance, trying to make ends meet, and being able to keep up with the inflation and the costs of labor, et cetera. And that's why I asked the question, because it seems like, I mean, there's been so many FTEs approved and all of this funding, but you know, I understand the growth problem as far as expenses and such. So, you know, sometimes sitting here, you get tired of hearing about we need more FTEs and we need more money, but I know it is a balancing act, and you know, just how it's presented, and you know, one way or the other is trying to get the job done. So thank you.
Thanks.
Thank you, Senator Rodkey. Are there any other member questions? Seeing none, please proceed.
This proposal also strengthens background study requirements for high-risk providers by adding the authority to conduct background studies for 4 high-risk provider types: ARMS, Peer Recovery Act, and recuperative care, and also providing the systems funding to implement those changes. This proposal also includes $500,000 of one-time funding in 27 for a phase 2 of the comprehensive evaluation of DHS's structure and processes. Right now, we are conducting the first phase of that under the governor's executive order. This would provide an additional investment to fund a phase 2 of that, depending on what that first phase comes out with. The intention of the review will be to look, whereas the other studies I was talking about was the global human services, this is really looking at DHS inside the agency. How should we be structured? How can we embed more program integrity within the structure of the agency? And how can we more effectively serve as the state's Medicaid agency? The next part of the proposal is clarifying communication methods for withholding and recovering funds. This is a technical change that allows us to utilize the biweekly remittance advice report as notice to a vendor or provider when seeking monetary recovery utilizing MMIS. Okay, going to the next proposal found on page 54. This proposal provides improvements to billing and payment oversight for older adult disability services and behavioral health services. The first component in this proposal is adding electronic visit verification to several new services. Electronic visit verification documents service delivery and allows us to analyze whether the delivery is aligned with the person's support plan and the claim submitted by the provider. This proposal would expand EVV to ARMS, peer support, CRS, ACT, EIDBI, customized living, FRS, adult foster care, adult companion services, adult day, homemaker, waiver transportation, NEMT, and CTSS. This proposal also adds or modifies billing limits. We would be setting max billing limits for several new services, and those are listed up there. I won't read them all. In the change page on this, it goes into detail in terms of what those billing limits are. This proposal also eliminates remote service provision for provider-controlled settings and adult day, community residential services, day support, family residential services, and ICS. This proposal also establishes an electronic record of a provider agreeing to the support plan. So right now, MinChoices is not visible to providers, and this proposal would establish a role-based access for providers to go into the MinChoices to sign the support plans and establishing an electronic record that the provider is agreeing to that level of service to the person. The proposal would also require HCBS residential providers to maintain staffing documentation on an ongoing basis to reflect the actual staffing and services provided, and would provide DHS the authority to collect that documentation directly from providers. Another item in this proposal is ensuring that the rates paid under DWRS reflect the services that are provided. So on many DWRS rate formulas, those are established by using staffing hours that are determined by the lead agency and service provider. For example, I'm gonna provide 5 hours of daily one-to-one hours. That goes into the rate formula and it spits out what a daily rate is, and then that provider bills the daily rate. This proposal establishes billing rules, making sure that the services that are actually rendered reflect what the rate is based on. And that if the service isn't within 90% of what the rate is based on, then the rate would be reduced by the difference. This proposal also aligns a person's needs, aligns a CRS rate framework with a person's needs. Currently, again, rates are set based on hours entered into the rate framework. However, there is no system mechanism to ensure that those rates align with a person's needs. This proposal would align the rates with a person's acuity by placing an hourly staffing limit based on the person's case mix. Similarly, we would align customized living rates with the person's needs by establishing aggregate limits within the customized living rate framework to the person's needs via their case mix. This aligns with how we do it on the EW program. And then lastly, this proposal expedites the sunset of the disproportionate share program by reversing last year's extension for the sunset to ensure that the rates that are paid reflect the services that are actually rendered to them.
Mr. Chair.
Senator Abeler.
I do have to credit your staff. You've got an amazing staff back there, and the creative writing that they do to sell ideas that are really horrible is commendatory. So the rates reflect a person's needs and the services are provided to them. Anyway, so without this kind of work, there's no place for them to go. And so there will be no rates to reflect any needs that will be handled. They'll be on the street. Anyway, and I'm sorry they made you come up and do this. I had many other things I wanted to say that I will restrain, and they probably knew that we liked you. And so they sent you up just with a smiling face. But I just wanted to commend their creative writing. It is amazing. Whoever does this, maybe I don't know who does it, but they're really good at their job. Thank you, Madam Chair.
So before I go to Senator Gruenhagen, I think the parts of the integrity stuff that you have, members, we probably want to pull that out and add it to our conversation. And remember, Friday is the budget, no integrity. We're just doing the budget, which means, whatever, it's going to go to John Marty from here. But we're going to hold the policy and we're going to hold the integrity side jointly. So as that, parse that out. So that's something I think we can easily do. There probably one other thing I want to pull from that budget bill that presented. Senator Abeler's a follow-up, and then let's go to Senator
Just in general, I
Gruenhagen.
want to blow through this so we can get to all the bills too, but, so I hope that the people watching at home, and Mr. Chair, there are probably literally hundreds of people watching this presentation at home, at least based on historical viewing. We really haven't had any hearings on any of this new policy stuff, and I hope the people that are affected by this will let us know.
Yep.
But I mean, it's a lousy way to do, and I know we're short of time, the late start, and everything gets us here, but I don't want to do any harm to the people that are doing a good job. So just please let us know what's problematic. And so maybe don't believe the creative writing, but sorry, that was maybe funny, maybe not. But so a lot of this stuff just came up kind of quick.
Yes.
And so the biggest errors we've made, Mr. Chair, have been things that get decided in a room and then get presented to the people, or it happens really suddenly. So, and I know that the present presenter is keenly interested in quality work that works. Thank you.
And to that point, Senator Abeler, that this bill as amended, we're just going to lay it over, and that this is a conversation point. We choose any, none, zero, the above, that's fine. Senator Gruenhagen.
Oh, thank you, Mr. Chair. Yeah, some of the reasons I ask the questions that I do is because, we've had federal funds frozen to the tune of about $500 million. And to the degree that we need to cooperate with federal directives so that we can actually help the people who need to be helped. Because I think all of us in this committee want to help people who need to be helped. So I do have a question, if I can use the word undocumented. Is that okay, Mr. Chair?
I appreciate you, Senator Gruenhagen. You may use that. I'm sorry, and I told you in the back. I know. I got triggered, man, and it's just
That's okay.
There's something about when you face something and you get triggered. It's just it's real. It's the reality. But I appreciate you. I always have, and yes, undocumented.
I appreciate.
Is it germane to what our conversation is? Then you got it, Glenn.
Hey, and I appreciate the Lord spared you and you're here, Mr. Chair. Anyway, so the reason I ask about undocumented is this is the area that if it comes to light with the federal government, my understanding is they're going to freeze federal funds. And, we've already been threatened with $500 million a quarter, which is over $2 billion of federal matching Medicaid funds. So does DHS have a handle on the number of undocumented immigrants that are here as far as receiving Medicaid benefits?
Yeah, that was always the filter, Ms. Bailey, was Senator Gruenhagen said from that conversation or that comment about there's $500 million that possibly. So any thoughts on that for him?
Chair Hoffman, Senator Gruenhagen, people who don't have legal immigration status are not eligible for Medicaid. They aren't receiving Medicaid except for when they're eligible for the Emergency Medical Assistance Program, or EMA. As far as I know, yes, we have a handle on it. They're not eligible for Medicaid, and our financing has appropriately adjusted for whether they are eligible or they're not. So I'm not sure where the question is coming from. To my knowledge, there isn't an issue there at all.
Okay. Just one quick follow-up.
Then we got to move on.
Yep. Thank you, Mr. Chair.
Yep.
Yeah, so the reason I'm asking is because we are in a tenuous situation as far as the freezing of federal funds. You know that. And I would...
Yeah, you've been talking about that. That's the scary thing you'd say.
Well,
yeah, go ahead.
And again, all of us want to help the people who need it, really need help, which I'm sure the department does too. And I just say that we really need to pay attention to these areas and cooperate with the federal government to make sure that we get the money to actually help the people who need it. So thank you, Ms. Chair.
Thanks for your advocacy, Glenn. And with that, we are going to Senate File 5042 as amended is just laid over possible inclusion. Thank you, Ms. Bailey. Oh, wait a minute. You know what I forgot? I thought it was just a proposal, but Paul, you're here to talk about.
Well, I haven't, I'm not done. I'm like not even halfway through, but I'm good to go sit down.
God, I'm really blowing it, aren't I? EMQ, you want to take over and I can, I better go back to comedy, Paul just said. God, I just completely lost it there for a second.
I already got a compliment, good writing skills. So,
I did. I would keep that actually,
Yeah.
was,
yeah.
if you want to keep going.
Okay.
And then members, if we can just let her get through and then we'll go right to, let's keep our questions till the end and then we'll get Mr. Verrett and Chris Westergaard. So go ahead.
Okay, the
Elise.
next proposal is centered around enhancing program integrity for integrated community supports, or ICS. This proposal would align rates with service delivery by establishing a 15-minute unit and incorporating billing units based on a person's acuity. We would also seek to authorize housing support for eligible people in settings and codify the federal requirement that prohibits the use of Medicaid funds for room and board. We also, with this proposal, would require electronic visit verification for ICS and add requirements for service authorizations, including documentation of need and prior authorization requirements for high-cost service packages. And then lastly, codify the licensing and setting moratoria for ICS. The next proposal is centered around nursing home program integrity. It would make the following changes to the payments to enhance payment integrity in the rates and to enhance quality of care provided to Minnesotans. There's two items in the rates right now that pay for cost twice in the rates. One is the plan closure rate adjustment program, and the other one is the performance-based incentive program, or PIP. The first one was initiated prior to VBR, and it pays a nursing home an additional rate add-on for beds that they have closed. We are already paying for that in the VBR rates because we're already paying the costs that the provider incurs, even though they're not billing for that bed or they're not incurring revenue for that bed. The second item is a performance-based incentive program. This pays for quality projects at the nursing home. However, that also was established prior to VBR, and those quality projects, the costs of those are also incorporated into the VBR rates. This would just remove those add-ons and just pay for those costs within the VBR rates. This proposal would also place a maximum limit to the reimbursement for health insurance costs and modify the quality limit in the formula to ensure that when we have increased costs that we're paying for in the nursing home rates, that those align with the increased value that Minnesotans are receiving in terms of care. The next proposal deals with market and receipt-based services. So on the disability and older adult programs, we have services that have rates that are established via market rates. So those are rates where the lead agency and the provider agree on what the rate should be. There isn't a standardized way to set that rate currently. The other way to set the rates are the receipt-based rates, which is, as it would sound, paying for the actual receipts for those services. Currently, there is no explicit limit on the administrative fees that a provider or lead agency approved vendor could charge for the costs of arranging or delivering a market rate or receipt-based service. This means that sometimes we're paying a large amount for the arrangement of the service. This would cap administrative fees at 6%. The other thing we want to do is to provide a one-time study that would look at all of these services that don't have standardized rate methodologies and recommend new rate methods for market-based rates. So what would be in scope would be 24-hour emergency assistance, assistive technology, caregiver living expenses, chore, crisis respite, environmental service adaptations, family training and counseling respite specialist, and a few others, and homemaking. And we would want to come back with a standardized way to set the rates so that we are appropriately paying for the costs that the provider is incurring, and that there isn't a variability in how much is paid for these services. Some other program integrity proposals we have in our package include fully implementing the mental health uniform services and standards. I think that's in the other jurisdiction. That's a holdover. Also, housing stabilization services, codifying termination of that program, and then directing us to develop recommendations to design a new benefit with robust program integrity requirements that would be delivered to the legislature to consider. Another proposal we have is an earlier effective date for improving supportive housing options. This was a proposal that we had last year and was enacted in the 2025 session that created a recovery residency certification initiative and at the same time phased out the freestanding room and board program. This proposal would expedite the effective date for that to this July. And as we phase out freestanding room and board, those programs would be eligible for housing support. The next proposal increases the fines and licensure safety. We would propose to enhance accountability measures by increasing fines for health and safety violations, as well as implementing additional enforcement mechanisms in the instance where there is threatening or abusive behavior towards DHS staff. Fines for license holders who violate health, safety, and supervision would increase from $200 to $500, and all others would be $100 to $300. Some other critical investments include a next phase of the 1115 reentry waiver. This would provide investments to support the reentry of incarcerated individuals into their communities. A few years ago, we passed that 1115 reentry waiver, and this would enable us to finalize that as we're working with CMS by establishing a post-release case management benefit. The second part of this is a federal compliance proposal around juveniles, where federal law requires us to provide screening and targeted case management services to juveniles in carceral settings for 30 days prior to release and at least 30 days post-release. So this proposal would do both and support people as they're exiting incarceration and stabilizing in the community. We also have investments in our proposal around the Medicaid access rule. So this is a rule that was published by CMS in May of 2024. And the goal of the rule is to improve access to care, quality and health outcomes, program integrity, and better address health equity issues in the Medicaid program across fee-for-service, managed care, and HCBS. This is a proposal that there's a lot of rules and requirements in the access rule, and we likely will come back in the next few years with complying with those rules. This initial proposal will provide resources that would enable us to increase transparency and accountability, standardize our data and monitoring, and create opportunities to have more active beneficiary engagements. The next proposal is would invest $10 million in the Human Services Response Contingency Account. This would enable us to respond to the immediate needs of people where there are health, welfare, or safety issues in which we have no funding source available. This was established in, I believe, the 2024 session, and this would add more funding to that account. This proposal is particularly needed due to federal action and federal funding uncertainty at the moment. Our proposal also, or our package also has several savings proposals due to the fact that we continue to have a structural deficit in the tails. So the first one is on page 156. It's sustaining disability services access through efficiency measures. This proposal would limit billing for residential services to 351 days to align with the rate absence factor. This proposal also modifies the absence and utilization factor for day services, would reverse the rate tier increases for family residential services, and would restrict the residential overnight factor in community residential services. The next proposal would shift the county share in the behavioral health fund from 22.95 to 50%. The next proposal would reinstate parental fees for incomes over 675% of federal poverty guidelines, or $222,000 for a family of 4. The next proposal reduces some disability grants. It would eliminate the innovation grants, mid-choices modifications grant, the pre-admission screening grant, the day training and habilitation grants in the base, and the long-term services and supports loan program. The next proposal would modify nursing facility level of care eligibility for CADI and BI. And lastly, the next proposal would limit inflationary adjustments in DWRS and VBR by having a 2% per year cap in the inflationary adjustments for those programs. Chair Hoffman, I have a bunch of budget neutral proposals, but I've been speaking for a long time, so I'm happy to pause or stop.
I think looking at the time, in those budget neutral proposals, I think we had moved a lot of those into the budget bill, but the other body is actually running those as policy bills. So we probably should remove those. Do you want her to go through all the budget neutral proposals? No? Huh? You're fully informed. You good? I think we're good on that. I think there's more questions. So the word cost savings is it's actually, when I look at the TEFRA, the battle of TEFRA, it's always seems to be on the block when it comes to, and what people don't realize is that people that have a child with a disability, they're actually saving the system money by getting an SDL and utilizing TEFRA. And so, and the piece about the dollar amount, there are people that go into collections because of increased TEFRA fees. That's why we got rid of John Marty. Actually was blown away when this committee eliminated TEFRA. You were, the part of that conversation. Do you remember that? Senator Abeler.
Yeah, it's a horrible plan. Anyway, back to my constructive, positive compliments. If you look at page 24, on line 2, it talks about enhancing the quality of care provided to Minnesotans. Mr. Chair, that just makes my heart warm. However, when you get to pages 32 and 33, which includes the TEFRA thing, maybe one of those ideas, with all respect to the messenger, they're all horrible ideas. And they're going to take away the ability. Actually, even the enhancing quality of care ideas are going to make nursing homes have less staff, be less able to serve. But you knew that. So you're just here, you're doing your job.
Senator Abeler, do you ever wonder that? You wonder who actually writes this stuff?
Is there a curtain?
I mean, I don't.
Is there like a Wizard of Prose?
Clearly, this is written by. I don't understand when you see some of this stuff. That language. I have concerns. Is it somebody who actually had lived experience in the community working, or is it somebody just looking at it as a spreadsheet and a cost thing? That you've raised that issue years ago, and it still sits in front of us today.
Mr. Chair, I will posit that they are well intended. However, I just want to make sure they realize that limiting the 351 days, absence factors, rolling back the tier increases for family residential, like really in that low quarter. Anyway, so.
No, you're good. Senator
Anyway,
Aki.
so it's just, and the disability grants and
After Jim's done.
Anyway, Mr. Chair, I am not enthusiastic about those. Thank you.
Senator Edke.
Thank you, Mr. Chair, and Senator Abeler covered some of the exact same things I was looking at. The enhanced program integrity and, quality in nursing home, and then you look over on the left-hand side and we're taking almost $72 million in savings And it goes through here. And once again, we can't be capturing that type of savings out of these programs and say we're increasing quality of care. They're taking money from programs that are already running a deficit and using them to buy something else in other committees. I don't know where this money's going to, but they're taking it from the people that this committee serves. And I don't see any fluff in the budget. All the way down to, we talk about a 2% rate cap. We just heard from the department that they can't hire because of the rates being what they are. They're losing out because the outside market is paying more. Well, we're telling our nursing homes, et cetera, DWRS, all the people working with the disabled and the elderly, that you got to do more with less. They're not going to be able to hire. They're not going to be able to even maintain the staff they've got. This isn't good. So I hope this is, honestly, hope this is going nowhere.
I know it, well, yeah, I mean, it is for the discussion. I mean, this is why it is that 2%. Remember our Senate position last year going into negotiations was, we did that, we did 2% as a, you know, starting point. We ended up coming, you know, back on that, but having 2% period, as an end game, yeah, I'm with you on that one, Senator Utke. So Senator Gruenhagen's got a little bit of.
Yeah, I just got a brief comment. Just, you know, I've lost 2 nursing homes, had to close in my district in the last several years, one last year.
Yeah.
And we pile more and more mandates onto the nursing homes, driving up cost, and then we want to reduce funding. And these are our most vulnerable. So I just don't know where the governor's coming from, to tell you the truth, but I'll leave it at that. You don't need to respond, but I just can't support that. Okay, I got nursing homes in my district that are just right there already. They're about ready to go under. And then we're gonna put more on them, or cut funding and put more mandates on? Wrong direction as far as I'm concerned.
You would not be open to any amendments that have that stuff on there, so thank you. Ms. Bailey, thank you for presenting. It is always a pleasure to have you on our committee. We're gonna bring up Paul, I think, yeah, Paul Verrett from the counties, and then Chris Westergaard, you're on Zoom land, so Paul, give us the ins and outs of the budget proposal from the governor's office.
Chair Hoffman, members, thank you very much. I am Paul Verrett, MAXA Director and Association for Minnesota Counties Human Services Policy Analyst. I'm happy to outline our thoughts on SF 5042, the governor's supplemental budget proposal. Starting with the human services system transformation proposals.
And just remember, Paul, you're on a 2-minute timer.
Yes.
Thank you.
Yeah. Transformation of our human services delivery system is a key element of this bill. Counties are committed partners in the conversation. We support the comprehensive study of counties, the roles and responsibilities of counties, tribes, and the state, provided that any direction in the working group does not presuppose conclusions. In Article 6, Section 8, we generally support shifting some Medicaid eligibility tasks to the state for individuals with complex needs. However, we need to know more about the point at which counties take responsibility for ongoing case management and how counties and the individuals we serve will have access to application status updates. In Article 6, Sections 5 and 9, we appreciate the proposal to develop a MnChoices support team to address assessment backlogs. We are already working with DHS on this, and we are ready to participate in another work group. Article 6, Sections 1 through 2, 7 through 8, we have some concern over the governor's proposed elimination of using managed care organizations in the Medicaid program, primarily due to its effect on county-based purchasing. Article 6, Section 10, counties use contracted waiver case management in a variety of very important ways, and this looks different to every one of our 87 counties. Counties appreciate the proposal's focus on a robust study that examines current uses of contracted case management, payment rates, guardrails, and discusses the proper role of counties. In the long-term services and support area, we appreciate the inclusion of several items that counties and others have been discussing as a part of our work to find savings in long-term services and support expenses in advance of proposed significant cost shifts and a raise to the county cost share as the legislature helped us to find last year. As you consider these reforms, we strongly urge the legislature to include language so that any savings can be attributed to preventing the county cost shift target. I want to touch lastly very firmly on the increase in the county contribution to the Behavioral Health Fund from 22.95% to 50%. Starting in July, the state will be assuming responsibility for Behavioral Health Fund eligibility as part of ongoing work to promote direct access of chemical dependency services by consumers. As such, counties will no longer have a substantial role in eligibility or provision of services and therefore should not bear the cost for services they cannot control.
All right, Paul, it's been 2 minutes and 30 seconds.
And that's actually the end of the list.
Thank you.
Thank you very much for your time.
No, I appreciate it. And you got that in writing too? You sent us all, everybody on this committee, a,
Yes. Yeah,
Okay.
it is all in writing.
all right, thank you. Next, Chris Westergaard.
Chair Hoffman and members of the committee, thank you for the opportunity to speak today. My name is Chris Westergaard and I work at Touchstone Mental Health and have been in the human services field for about 25 years. I'm here to express strong opposition to the proposal to move integrated community supports from a daily rate to 15-minute billing units. At first glance, this may seem like a technical change. In practice, it fundamentally misunderstands the nature of the people we serve through ICS. Individuals receiving ICS services, including adults with serious mental illness, brain injuries, and other disabilities, do not experience their needs in neat, scheduled 15-minute increments. Their needs are often unpredictable and intermittent, including sudden mental health crises, seizures, assistance with toileting, or support during moments of confusion or distress. A daily rate allows providers to staff appropriately, to be present, responsive, and ready. Moving to 15-minute units will force providers to staff to billable time, not to human need. The result will be gaps in coverage, reduced responsiveness, and ultimately people going without the support they need in critical moments. When that happens, the consequences are not theoretical. We will see increased emergency room visits, more hospitalizations, and greater reliance on higher levels of care such as nursing homes, settings that are more restrictive, more costly, and often inappropriate for these individuals. We simply do not have the capacity in those systems to absorb this shift as well. Most importantly, this change undermines the core goal of ICS, helping people live as independently as possible in the least restrictive setting. This proposal would fundamentally move in the opposite direction. A separate bill is being proposed in the House to convene a work group to evaluate ICS and develop solutions for current ICS settings. We should take the time to thoughtfully assess the service, engage stakeholders and consumers of the service, and make informed improvements, rather than implementing a sweeping change that risks destabilizing care. I urge you to pause this proposal and prioritize the work group. Thank you for your time and consideration.
Thank you. That was 2 minutes exactly. Chris, and thank you for the reminder of the House, the other body having that conversation. That's just going to be where we're going with a lot of this anyway. So, members, that way you're going to take Senate File 5042 as amended and lay it over for possible inclusion. Next up, Senate File 5029, Carrie Briones. This is, members, this is the proposal for the direct care and treatment folks. There are 3 provisions in here. If you could just give us the highlight, you go section by section. I'm going to gavel you out faster than you can. I'm kidding. If you want to give us the highlights on it, one that's exciting is the communication, the cameras on the body cameras, which I was going to ask you, did we ever fix the radios in down in St. Peter? You know, the talking back and forth thing. So
Go ahead.
For the record, my name is Carrie Briones. I'm the Legislative Director for Drug Care and Treatment. Chair Hoffman, do you want me to respond to your question now about the radios and forensics, or?
No, no, I mean, no,
okay.
I'm, this is really,
Okay.
this is stuff that, you know, Dan, you and Dan, it's like, my God, this is like real stuff that needs to get done. So, yeah,
Okay.
you're on it.
Okay, so.
all yours.
Yeah, our bill is very short. I will just start to share with members that all items are budget neutral, which we find exciting. Section 1 really just is a statutory cleanup. There's a leftover DHS reference that is related to accepting gifts for patients. DCT already has this authority in its own chapter, just again cleaning up a statute. The patients that are referenced in this part of statute are under the jurisdiction of the DCT Executive Board rather than a DHS commissioner now. So pretty straightforward change there. On sections 2 and 3 are related to security body scanner requirements, and what the intent of this language is to do is to remove let me start over. Allow us DCT to explore using operating security body scanners in its secure facilities. And what this goes to is that there's an exemption that was provided in 2019 to correctional detention facilities for the employees who operate security screening equipment on humans from certain examination and inspection requirements. And those requirements really have to do with being in a medical setting, right? That's someone that would be completing x-rays on individuals where this is a security scan. And so really this just really goes to increasing safety and security by preventing contraband from entering our secure facilities, but it also goes a little bit further than that. It supports the dignity of those we serve by removing the need for invasive and potentially traumatic unclothed body searches. So this would allow for clothed body searches for contrabands. Also balances security needs and behavioral health facilities with the rights and well-beings of those that we serve. And to share that we did consult with MDH to make sure that our language is implementable and safe. And the last item, again, very short this year, is really what this is related to, is extending the appropriation availability for the DCT County Correctional Facility Support Pilot Program. This pilot was part of the 2024 session, results of the work of the Priority Admissions Task Force. This original appropriation was $2.3 million, but is only available until June 30th of this year. Due to the time needed to get the pilot staffed up and running, the full appropriation will not be spent. We'd like to carry over and have more time to spend the funding. This work has continued to gain momentum and increase interest from our county partners and county jails. It will be allowed the continuation to allow to continue efforts to support county correctional facilities and safely and effectively administering psychotropic medications, including involuntary and injectable treatments to incarcerated individuals with serious mental illness, and it will reduce delays in treatment, improve the safety of those individuals and staff who are working from them. So I sped through that really fast, being mindful of time. Do you have any questions? I'm happy to respond, and we do have staff from DCT here with expertise in some of these areas that can help me out if I don't know the answer.
I don't see Store Camp around. Where is he?
He is not here today, Chair.
Senator Abeler, you want to ask her to go section by section?
Well, I just wanted to point out the efficiency of DCT.
Amazing.
4 pages, you know, no repealers.
Did we do that well last year when we set this up?
Well, Mr. Chair, they're a small agency. They don't have the prose writers like DHS has. So, Mr. Chair, may I ask a question? So I'm just curious, how is Miller coming? Is that on track with the design and all that?
Ms. Briones.
Chair and members, yes, that project is on track. It is on schedule, assuming nothing goes wrong. It is on the timeline, and I can certainly follow up with dates and a more accurate timeline. I just don't know off the top of my head.
Mr. Chair,
Senator,
that's amazing. So I should remind the public that it was this committee that helped that project come to life. And as a very collaborative process in the genre that this committee has worked. So how about that? Thank you.
Thank you for that reminder. And yes, it was wonderful working with that on that. So thank you, Ms. Briones. And then we should probably, after third deadline, maybe you and Dan can give us an update on Miller and anything else. And I do have, I do want an update on the communications systems that, if I remember right, there was some they were using cell phones in order to communicate because of the radio frequency drop off. So you can do that too at a future date as well. That would be up to us. All those members, we're just gonna lay that over Senate File 5029. We'll lay it over possible inclusion. Thank you. Thank you. Senate File 4512, there's, this is Waiver Reimagine. There is, come on, the task force, come on up. It's Julie Johnson, Linda Wolford, Tricia Brisbane, Katrine Bachmeyer, Chris Erickson, Cindy and Jenna Johnson, and Jillian. Looks like Jillian's going to be on Zoom. Also, Chris Erickson's on Zoom. So maybe the first three, Julie, Linda, and Tricia, come on up. There's multiple proposals. Who's that?
Linda's on Zoom as well.
Oh, Linda's on Zoom too? Oh, sorry, I didn't. Thank you. Ms. Johnson, just to know that there's a couple of different proposals on this, and you know, this committee's gonna have to find the money because we already took the savings. Where's Miss Bailey when you need her? We took the savings a couple years ago, and then, I think it was a couple years ago, and then that was, no, it was 2017, 2019, 2021. It was a certain senator. You took the savings, right?
They said it was going to be amazing, Mr. Chair.
And-
like, maybe it's still the same writers. They were. It was Shangri-La, as I recall.
It was,
Thank
we have to pay for, this committee's got to find the money to pay for it. It's like everybody's on the table saying, yes, let's postpone it. Is it 1 year? What's the cost? If it's 3 years, what's the cost? Regardless, we have to find the money to fund it. So, Ms. Johnson, the table is yours.
Chair Hoffman and members of the committee, I am Julie Johnson. Thank you for the opportunity to testify on behalf of the Waiver Reimagine Advisory Task Force. We do appreciate your bill proposing a 1-year delay. This is a meaningful step in the right direction, but the task force has concluded that 1 year is not enough to ensure that Waiver Reimagine avoids unintended harm and fully meets its stated goals. The scale and complexity of this reform will require more time than the current proposal allows. Last month, DHS announced a delay in the launch of Waiver Reimagine. This announcement did not include clear timelines or information on what that delay entails. Without clarity, stakeholders remain unable to plan. The legislature created the task force during the 2025 special session and directed us to deliver findings by January 15th of 2027. We reviewed the available data and information and acted early because this is after the go-live date for Waiver Reimagine, recommending a delay in implementation for up to 36 months. We identified 3 major areas of concern. First, program integrity. MinChoices 2.0 will determine eligibility and budget ranges, yet its reliability and validity has not been tested. A 2021 legislative report emphasized that this testing is essential. Without it, we anticipate increased appeals, inconsistent outcomes, and potential legal exposure. Second, system readiness. Federal requirements demand assurances that the budget methodologies do not inadvertently limit choice or steer individuals towards more restrictive settings. People will not have the budget ranges in time to prepare. A transition of this magnitude requires predictable timelines and adequate preparation, which we do not think are achievable by 1/1 of 28. Third, fiscal exposure. Waiver Reimagine intersects with other major program integrity efforts. Minnesota has recently had experience with administrative and financial consequences of rushed implementation. Without integrating those lessons learned, the state risks increased costs related to noncompliance, litigation, and most importantly, continuity of care gaps. Waiver Reimagine is one of the most consequential structural changes in disability services in decades. Implemented thoughtfully, it can advance equity and sustainability. Implemented prematurely, it risks instability, higher costs, and erosion of public trust. A longer strategic pause now protects legislative intent and strengthens long-term stability. The task force remains committed to working collaboratively with DHS and legislators to ensure that Waiver Reimagine succeeds the first time. We urge you to consider a longer delay in this timeline so we can do this right.
For 3 years.
Thank you for the opportunity to testify.
Thank you, Ms. Johnson. We got to stick to the 2-minute piece. members, you'll see packets, there's some letters from folks. I want to point one out. There was a Jensen settlement accord that happened a few years ago in the state of Minnesota, believe it or not. There's a letter from O'Meara Wagner, attorneys at law, PA, regarding Waiver Reimagine. Pay attention to the second page. When I start to hear people that have stood up for, or not stood up, but actually fought for the rights of people with disabilities, like Seamus O'Meara has done here in this letter, and uses word like, you know, people wrongly impacted, discriminatory contact, people that assert their civil rights, including with a class action lawsuit. Whenever I see words like that from Seamus, then I know that something's serious here. And so we have to get this right. And the task force, 1 year cost, 3 year cost, whatever it is, but I appreciate that, Ms. Johnson, for doing that. Ms. Wolford, Linda, you're on there. If you could, if somebody's already covered something, just let us know. I mean, this is the thing that, this is an opportunity not just to have people say the same thing, but rather what it is that this committee needs to know regarding going forward. So, all right. Thank you. Ms. Wolford?
Hi, can you all hear me?
Yeah, we can. Hi, Linda.
Wonderful. Thank you. Good to see all of you. Welcome, Chair Hoffman. I get to say hello. Unfortunately, it's virtual. But when you have PCs, it's a little hard to get around sometimes. So, Chair Hoffman, members of the committee, I'm Linda Walford. I am a member of the Waiver Reimagine Task Force as appointed by the Minnesota Council on Disability. So that's who I am representing, and I'm a co-chair of this task force. So I just want to speak from the heart. I don't have prepared. I'm going to try to just add on to what Julie said very eloquently, but kind of maybe plain language a bit. I'm a person who relies upon services, as do some members of the task force, and just many of the community members who I interact with or have interacted with in my long career at both DHS, the University of Minnesota, and most lastly, the Minnesota Council on Disability. And some of the things that people are bringing up, that they're very fearful about implementation of Waiver Reimagine because they feel like their budget could be significantly cut. Some of that, I think, is very real. And one of the reasons, and I know this has been a long, ongoing issue, is the Min Choices assessment. Because if we don't have an assessment that can accurately measure people's needs, no matter what the setting, then the budgets are never going to be right. And I think that we have asked DHS to come back with us with some idea about some cost analysis of, do we continue? Because we put a lot of money right in Min Choices assessments, as I believe this committee members are all aware. But it has not been pilot tested. It has not been, mourned. And there are assessments that are on the shelf out there that other states are using where those things have occurred. So maybe it would be worthwhile to look at some of those assessments and they actually target it to the person's disability type,
All right.
not to meet everyone's needs. So I'm just encouraging thoughtfulness about thinking outside the box instead of sticking with what we have, because is what we have going to do it, or are we just going to keep throwing millions of dollars to try to get this assessment right?
Thank you.
For the how many years?
I agree, Ms. Wolford. That is absolutely, let's get this assessment right. Ms. Brisbine, welcome back to the committee. Nice to see you.
Thank you, Chair Hoffman. I appreciate the ability to be here. Members of the committee.
Full disclosure, she's a constituent, just so you guys know that.
And I brought Charlie with me today.
Where is he?
He wears cool shoes. He's the tall guy.
Oh my God, he's right behind me. I couldn't see you because people were sitting there. Charlie, how are you?
Do you want to come up here?
No, I got it.
All right. Well, I appreciate this. Thank you, members of the committee, and thank you, Senator Abeler and Chair Hoffman, for bringing forth this bill. The pause is, it has to happen. I have my testimony here, I timed it out, but a lot of it's repetitive, and it's repetitive of what you've been hearing from me every time I come. You've heard in the letters from people from the Governor's Council, other stakeholders from the task force. We've been telling this committee and DHS for a very long time that we are more than concerned with Waiver Reimagine. It is going to cost us lives and dollars if we don't do it right this time. I look at it as an opportunity for DHS. Stop with the creative writing. Work with us to create something that works for everyone. It seems like there's all of this behind closed doors, we're gonna decide what's right for you and the community, but we're not a part of it. We don't get to talk about it. Advocates don't get to talk about it. Other stakeholders aren't saying, great idea, but that's not gonna work in reality. I think it's an opportunity for DHS to maybe course correct how they typically go about things. Start working with us as partners, true partners in the process to get the waivers right. Thank you so much for your time. It's greatly appreciated.
Thank you, Ms. Brisbane. And Charlie, it's nice to see you. Katrine Bachmeyer, as you start coming up, and Cindy and Jenna Johnson, as you start coming, Chris Erickson, let's go to you on Zoom land.
Hi, thank you. Thank you, Chair Hoffman. My name is Chris Erickson. I've been a registered nurse for 27 years, working in quality, compliance, and risk. Finding failures before people fall through them is my expertise. I am also a Waiver Reimagine Task Force member, but today I'm here as a mother. My 14-year-old son is on a CAC waiver, community alternative care, or hospital level of care. He's recovering from his 26th surgery. This is not policy to me. This is whether my child and others like him stay alive. My son requires 24/7 hospital level of care. We provide that at home inside a system that is already strained, already inconsistent, and already failing to meet needs. And now we're being asked to trust the same system to undergo massive redesign. This is not safe, this is not responsible, and it is not ready. CAC recipients are the most fragile, medically fragile Minnesotans. There is about 700 participants. There is no margin of error. When the system slips, the consequences are immediate. Now layer in the min-choice assessment, a tool without reliable measurement and already known to reduce supports for the most complex. In healthcare, when your measurement is flawed, you stop, you do not proceed, because every decision built on it will be wrong. So let's call this what it is. We're preparing to redesign care for the most fragile people in this state, using a tool that cannot reliably measure their needs inside a system we already know is not stable. This is not innovation, this is compounded risk. And when the risk is clear, moving forward becomes a choice. Here's the reality you can't ignore. Providing unlicensed care for my son at home is provided within his annual budget of $181,000 a year. The licensed nursing care he needs and is entitled to costs about $383,000. We currently don't have a budget to meet his hospital level of care needs. The system relies upon families to fill the gap. Waiver Reimagine is projected to cut this funding in half, while his needs remain unchanged. Reinstating TEFRA leaves a bad taste in our mouths. Families like mine, the outliers, are already cutting every corner, and this cuts to the bone. If we were to just admit,
Go ahead, why don't you finish up what you were
Yes.
starting to say there, Chris?
Yes, sir. If we were to admit him to our local pediatric specialty hospital, that bed would cost about $100,000 a week. If the system fails, he doesn't have the state money. He would cost exponentially more, and more importantly, he will not survive it. So I'm asking you to make a difference. Delay Waiver Reimagine. Please, I'm begging you, exclude CAC recipients in an amendment and stabilize what is already fragile before you redesign it. I respectfully ask you to delay, stabilize, and protect. As Paul Wellstone would say, when we all do better, we all do better. This is our chance to please do better.
We
Thank
will.
you.
Thank you, Chris. We will do better.
I trust you.
Katrine Bachmeyer, Cindy and Jenna. Hi, Jenna.
Hi.
How you been?
Good.
You got a microphone by you?
Yeah.
All right, awesome. Go ahead, Katrine.
Thank you, Chair Hoffman and the committee. I'm a governor-appointed subject matter with over 30,000 hours of research on Waiver Reimagine. That includes direct communications and technical assists with CMS. I'm also appointed to the Legislative Waiver Reimagine Task Force and a household member directly impacted by these services. Thank you for initiating SF 4512. I fully support it. On March 16th, the task force, including DHS members, requested a delay of up to 36 months. I urge the committee to read that letter. As stated, the cost of corrective action risks eroding projected near-term savings. While 1 year helps, the request for 3 years is a deeper issue. The statute directed the task force to review and make findings. The task force report is not due until January 2027. That is after the initially planned rollout of Waiver Reimagine. So the sequence is reversed. DHS implements first, and the oversight is occurring after the fact. During the legislative stay, DHS embedded major policy changes, including CDCS unbundling and restrictions on self-direction through waiver amendments outside the task force review and legislative review. No cumulative impact analysis has been conducted. The data now driving the HSRI budget model was generated under those same restrictions. And this is really important because Minnesota has the most severe long-term care, home care nursing workforce shortage in the country, nearly 20 times other states. Federal guidance calls for expanding flexibility and self-direction under these conditions. Instead, it was reduced. I asked the committee to reconsider needs versus location-based federal requirements, to formally affirm the task force's statutory role and the legislator's statutory role as an oversight checkpoint prior to any CMS submission, consistent with prior public statements. And this task force and the legislators ensure meaningful stakeholder review. And without that, Minnesota cannot meet federal requirements. So please pass SF 4512, review the task force letter, and issue that clarification for the task force.
Thank you, Katrine Bachmeyer. Jenna. Or Cindy, who's going first?
Me.
You,
You let me go first. I'm sorry. Okay.
I am so scared out of my mind if this doesn't get.
your microphone's not working. Can somebody
There you go.
get a hold of Radio Shack? You
Underneath,
got
yeah.
questions, they got answers. You remember that?
Say it again.
Remember that commercial?
Okay. I am so scared
Thanks,
out
Jenna.
of my mind. I can't believe this is happening. And
Mom will explain it.
yeah, my mom will explain.
Thank you. Well, this is Jenna and Greg, and we're the Johnsons. And Jenna actually was appointed to the Waiver Reimagine Task Force by Governor Walz as a person using disability services. And she's done a great job. A lot of times I have to speak up for her because it takes her a while, but we've worked as a team. Jenna has complex medical care needs that require 24/7 care. She doesn't look like it, but she does. She now has the best life she can, choosing to live in her own apartment, and we as parents have sacrificed time, money, and all of our energy to help her live well. We're so worried about the consequences as proposed. Based on the current methodology and the only methodology we've been given, her budget is reduced in this plan by 80%. And I'm not making that up. We actually ran the numbers, and it results in a decrease in her staffing from 24 hours a day to only 5 hours a day. She cannot live safely with that low level of care and would be forced into institutional care, group home, or hospital care. None of these options would cost less or be a good life for Jenna. I appreciate the proposed 1 year delay by Senator Hoffman. Jenna and I jumped up and down, and I actually cried, just even to think of 1 year. A delay means Jenna can live 1 more year with a waiver that meets her needs and stay home. But then what? That's what we're so worried about. DHS has not made adequate provisions for what to do with all these people with disabilities that will be devastated, displaced into a system that already has long wait lists, shortages of nursing, and shortages of staffing. The task force created by this legislature has diligently met. We studied the proposals, we've worked together, and we have sent you a report that's in the packet. And we did recommend 3 years.
Yeah.
We so appreciate the 1 year, but here's the thing. We don't still have a workable methodology, even after spending millions and millions of dollars on HSRI. They have not produced any fix or any legitimate plan. Any pause is necessary and appreciated, but we think the system is totally broken. Let's do it right and do it right from the start. We may have to just get rid of it. It doesn't work.
Cindy, thank you. Wow, Jenna, we go back years.
Yes, we do.
80%, but there was a bunch of
80%.
senators on this committee that just, you heard the 80% what? 80% of what? 80%?
Well, Jenna's budget right now would be reduced by 80%, so she'd only have 5 hours. And that's based on, they have charts from 2019. They haven't updated them from then, if you can believe that. So maybe it'll be different once they come out with some numbers.
Yeah.
But why are we paying them millions of dollars if we don't even have, it's scared families to death, and we don't even have accurate numbers? What is it gonna be?
Isn't there a maintenance of effort issue that goes into play here someplace, or does that not count anymore?
I don't know. The only way Jenna could be safe is someplace that could provide 24 hours of care.
Oh, so institutional care, so this.
Exactly. And why have we built a home, put in an elevator?
And I want to stay at home.
She has an apartment that totally meets her needs. Her grandma's her roommate, so we're saving the system an elderly waiver. And why are we doing that? It doesn't make any sense to me. It's just wrong. And Jenna totally knows what it means. Sometimes she's awake at night and it's just wrong.
So, Senator,
Well, Mr. Chair, my jaw is just on the table. I can't think that anybody intended that to be true. And so I don't doubt a minute your calculation. I show you a mea culpa, Mr. Chair. I've had some successes and some failures in my career. I think the biggest failure I had was believing that DHS would do a collaborative process. And they talked me into it. They said, oh, we got to get done all this stuff, and like, it's going to be fine. And so we argued, I was sent with Commissioner Harpstead. Mm-hmm. Not that they would consult, but they would collaborate. Mm-hmm. And Mr. Chair, that's not happened. And time after time that we hear from these amazing people, and Ms. Erickson said, I don't know if you heard her at the end of her thing, Mr. Chair.
yeah,
I trust you.
I trust you.
And
Yeah.
I don't know. I don't know even know where to get the answers, but this is, let's cost lives and, supposed to be an opportunity, but I don't think we knew opportunities to cost lives, Mr. Chair. I'm sorry. I just feel like I got hoodwinked. And I don't think that Jody intended to, but the term was collaborate. And we argued about that, and it took her days to come to that position where she would yield to my demand that it be a collaborative process.
Correct.
Which means that there's a part here, and there's DHS here, and there's all of you people there, all the families and Jenna and everybody, and like, we're gonna come up with the best way. I'm not sure we have the best way, Mr. Chair, but thank you.
Thank you. Thank you, Cindy. Thank you.
Mr. Chair, can I make one more comment, please?
Absolutely.
My husband is very good at technology stuff, and we came up with a really, really good PowerPoint that we shared within the task force with the facilitator and with DHS. And I tried to get through to you and to Senator Abeler to meet with us to see that presentation, because it showed exactly how the numbers came out. And I'm still willing to do that or send it to you if it would help.
Yeah, as we look at having a conversation, I mean, going forward, Cindy, we are going to get some kind of pause here, right? Right. This committee is committed to doing it right? Whether it be a 3-year
Mr. Chair, so
Senator.
if it's delayed 3 years by DHS, that money gets to come out of the forecast.
Correct.
If we delay it 10 minutes, we have to pay.
We have
Is
to
that
pay
the way
for
that
it.
goes? That just seems,
Is that correct, Ms. Bailey? If DHS, if we did a 3-year, would that be forecast? Kyle, do you guys know that?
Mr. Chair, I'm sorry, what was the question?
If we delay this for 3 years, it's forecasted. It comes out of the, it's forecasted.
no, if DHS.
If DHS, sorry,
They
thank
can't
you.
do it, that comes as a deficiency, and then it magically comes out of the forecast and takes away from the bottom line. If we want to do it intentionally,
We have to pay for
we
it.
have to pay for it.
Yep. Does that make sense?
Which, so
Mr.
can we just pretend we're them for a while, Mr. Chair?
Yes, yeah, we can.
So, Mr. Chair, yes, that is correct. So if there are delays to implementation that are administrative in nature, it gets updated into subsequent forecasts. So it would affect the bottom line the same way as if the legislature took action. However, if the legislature takes action to delay, then it gets counted against the bottom line in terms of a fiscal note and how that would against the state bottom line.
So we have to pay for it twice.
Senator Hoffman, if I
Yeah.
may, we've been doing this since 2019, so we've already had a lot of delays that we paid for. And what my biggest concern is, when you get to the end of this 1 year, 3 year,
Yeah.
we still have a faulty
Yep.
methodology done by a company that many states have sued and thrown
Yep.
out the work. And so
Yep. Very aware of that. Was there, listening.
I've been here a
Was not
lot.
impressed. You were good. Jillian, can you take us home, and then we got to get going to Senate File 4512. I don't know what I want to do with this, folks, but go ahead, Jillian.
Good afternoon, Chair Hoffman and committee members. I'm Jillian Nelson, Policy Director for the Autism Society of Minnesota and a waiver recipient. I wish I was there in person, but some days disability keeps me in bed. It's with great gratitude that I'm here today to speak on behalf of Senate File 4512. Waiver Reimagine needs to be delayed for a year, or better yet, until DHS gets it right. We've been here in this room and at DHS discussing this for nearly a decade. We have delayed it over and over again, and we keep coming here with the same arguments. The budget models proposed will harm people. The budget models proposed will force people into institutional settings. The budget models proposed violate Olmstead. The budget models proposed will cause an increase in Medicaid spending. We need to do more at this point than just delay another launch date of a program that is designed to fail the people it is supposed to serve. We need to do more than set this community up to panic for another doomsday when another poorly pieced together program will theoretically launch. We need to give DHS a deadline and expected guidelines for what they need to accomplish in this delay. Number one, a budget model that will not incentivize living outside the community and remove self-directed service models. A budget model that will not see people's budgets slashed by 50% or more overnight with no change in needs. We brought a bill this year, Senate File 3757, that would block cuts beyond 10%, and DHS says it was unimplementable. They know what is going to happen. Number two, we need transparency for the community on what this new model is actually going to look like and how we will be served and how those needs will be determined. I was told a year ago that someone would get me a list of covered services in Waiver Reimagine that are separate from the budget, and I'm still waiting for that list. And last I heard, even Kevin Parker had not seen it. Number three, we need modifications to min choices that actually align with how people with disabilities experience the world. 2 examples. Currently, someone using a power wheelchair does not get rated as having mobility support needs. Or someone with a developmental disorder that requires constant queuing to shower does not get rated as needing hygiene support unless they have to be physically lifted into the shower.
I'm going to ask you to wrap it up.
We also need a model that allows individuals to receive habilitation supports and allow individuals to continue to grow and thrive rather than staying stagnant in skills. So thank you for delaying launching something harmful and for the consideration of pushing expectations on what we expect from DHS. I appreciate all of your work.
Thank you, members. I move that Senate File 4512 is laid over for possible inclusion.
Ask your question after.
You sure can,
interim time
Senator.
while we take up your next bill.
Yep.
So if we delay it, looks like it costs about $18 million per year once it's kind of going to delay it. Can Mr. Raymond, not right now, but tell me the gross expenditures in the programs that are affected by Waiver Reimagine? And Mr. Chair, my idea is if we look at the gross expenditures that are in Waiver Reimagine and look at what $18 million is, we could say that, we could even look at that percentage and then double it, and for free say no program can be cut more than that number. And so some would be a little higher, some a little lower, and that should be free. So just a thought.
Yeah, I'm with you on
This
that.
has got to be $1 billion or something.
Sure, it's got to be free. Can we get technical assistance from Elise Bailey? Not now, I mean, but put it in your,
No, but so Mr. Raymond, if you could just
For
give me that
Wednesday,
number
too?
of the, just the programs that are there, and then I'll do some math. And
Okay.
Thank you, Mr. Chair.
thank you. Mr. Raymond, is that pretty clear? That's good. And then I still want to pick the department, the finance side of it, that question that needs to, and maybe Ms. Bailey can not come down here right now, but this is something you can put in your,
Mr. Chair, perhaps the theme of this year could be collaboration, we mean it. And I don't think that any of the people back there would not want to collaborate.
No.
So that was the deal. And I don't hear any of the testifiers today saying they felt like they were included in any meaningful collaboration whatsoever, which they've broken the law, Mr. Chair. Do you realize, Mr. Chair, that that is a fraudulent application of the, anyway, that it's, maybe we should get the Attorney General in there to fix that.
Senator Rasmussen.
Please follow the law.
Did Senator Abeler's reading the Seamus O'Meara letter, I think, so. Senator Rasmussen.
Thank you, Mr. Chair. And I just think one of the testifiers made this point that this has been talked about since 2019.
Yeah.
And we had, independent of any action taken by this committee, the Walz administration announced that they were going to be delaying this indefinitely, right? Delaying the implementation of Waiver Reimagine. And I think, Mr. Chair, it's a shame that we have an administration that's been in office for more than 7 years and really hasn't figured this out. And I think it's a disappointment to the families. I think it's a disappointment to taxpayers that are looking to make sure the dollars are being spent efficiently. And I hope, Mr. Chair, that we get a governor who cares about this kind of stuff and can prioritize actually doing this work instead of talking about doing the work, studying doing the work, having work groups to talk about maybe doing the work at some point, but the work actually has never gotten done. And I think that's the core challenge here. When you go back to what Senator Abeler was talking about, that collaboration and figuring it out, that work hasn't happened.
Kind of like how we do work in this committee.
And I think that's just my message to the administration today, Mr. Chair.
Well, it's also a future message too. We on this committee leave our ego in the hallway and we actually have discussions, hard discussions, and we don't agree all the time, right? There's many times we disagree on lots of stuff, but we don't personalize it. This committee doesn't personalize that, which is amazing. So I appreciate that. Let's bring up, I already said we're gonna lay that over possible inclusion. Senate File 4452, Lori Wilson and Don Shelby. You know, there was once a quote, where's my thing? This is, folks, this is a bill that appropriates money to a Metropolitan group or residential facility. Turning Point was founded in 1966 by Dr. Vincent Peter Hayden. Ring a bell to anybody? Provide culturally specific inpatient and outpatient treatment services, housing, and support services. Members, this facility does case management support groups, education and educational assistance, and direct access to hub services through their specific services. The appropriation is intended for needed renovations that provide a better living space, an environment for Turning Point clients to heal. There was once a person who said, "Never be afraid of life. I urge you to run to the horizon with your brain, your body. Just keep active." Don Shelby, do you know who that was?
Yes.
That was well done, well taken. Never be afraid, right? I urge you to run to the horizon.
Yes.
Run to that horizon. It's everything you've done your whole career. So welcome you two, Lori and Don. If you want to give us your name.
Thank you, Senator.
We can go. Who's going first?
I'll go first. Thank you, Chair Hoffman and members. I appreciate this opportunity. My name is Lori Wilson. I am the CEO and president of Turning Point Treatment Center in North Minneapolis. Been there for 50 years now. We are celebrating our 50-year anniversary. So I want to just give you all just a kind of a story, the ask, right? We currently have we serve 250 individuals a year with an 87% overall completion rate. At Miss B's, the location that we're looking to do some renovations for, we average 22 clients a day, 154 clients a week, 4,620 clients a month. We need to renovate our space so that we can have a conducive space and do services that the people deserve. Statewide, from 2019 to 2024, Minnesota had 4,637 men and women that died from some type of drug overdose. Of that, 1,375 men and women, African-American men and women, which is 20%, died within that time frame as well. Even deeper, 59% of those individuals are in Minneapolis. With the potential cuts and of Medicaid, next year is going to be, a hard one for us. But we cannot dip into those funds to do renovations. We have, to your point, Senator, we have, HVAC issues. We have renovations that haven't been done in the last 20-some years. So we need to get this done so that we can serve the individuals. This is for our community. This is for the city. This is for the state. And we talk about those who are fighting this horrible addiction. We need it for our folks. So I'll say that, and I'll let my counterpart here finish this up. This is not only a public health issue, public safety issue, but most importantly, it's a human services issue.
You get to the why we do what we do, Ms. Wilson. Thank you so much. Mr. Don Shelby.
Thank you. And thank you very much for being a sponsor of 4452. A lot of people might look at me and wonder why a white guy is the head of a board of a culturally specific African-American organization. Well, I'd have to testify for about 6 days to tell you that story. But the short version is this. The clients that Turning Point has been seeing, more than 20,000 clients over the past 50 years. We have something in common. And you may know this, you may not know this, but I will tell you for the record. 46 years ago, I was hopeless. I was a hopeless person. And the clients we see are hopeless. 46 years ago, I had the opportunity to receive chemical dependency treatment for alcoholism. And I know these people who come through our doors. I feel them because they hurt just like I hurt. But the difference is this. There's this phrase in Alcoholics Anonymous about getting off the bus uptown or getting off the bus downtown. I got off the bus uptown, maybe because I was white, maybe because I had some money, maybe because I had a job, maybe because I had a family and a house to go back to, and a reason to be straight and sober. These people are getting off the bus downtown. Not only
is the disease hopeless, but oftentimes their conditions are hopeless and they don't have the place to go back to. So that's the importance to me of Miss B's house, because in the literature of recovery, that's kind of an aftercare. That is a soft landing for people who have gone through 3 months of treatment, not 28 days. It's a soft landing. That's a safe place. And it's falling apart. And if you tell someone that they have committed 90 days of their lives and gave up that which they depended on to relieve their pain, that their condition is going to be just the same as that which they left. We need a nicer place, a livable place that tells them you have done something wonderful for yourself. So I urge you to support this bill so that these people can have the exact same thing that I had. And anything less than what I had, it has a name. There's no reason why these African Americans who have chosen to become productive citizens free of this disease should be treated any differently than I was treated. Thank you.
Thank you. Thank you for getting to the why we do. January 3rd, 2016. For
There
me
you go.
on.
There you go. Yes, sir.
So we got a couple of options. Either lay this over for possible inclusion, or it really it jobs. But in order for it to go to jobs, which is where is headed, we could either keep it or we got to go through rules to go to jobs. So I think we should do something here.
Mr. Chair, may I say one other thing and address it to Senator Gruenhagen?
If Senator May Quaid wanted to, I asked, can you hold that thought for a second?
Yes.
Thank you, Mr. Shelby. Senator May Quaid.
Thank you, Mr. Chair. I'm not 100% sure that the Jobs Committee is meeting anymore this session. And so. We're meeting Wednesday. Oh, you are? Wednesday. Great. Would we have time to get it there?
So if we do that, we'd have to go through rules to get back there because it's beyond second deadline. But Senator Abeler, to those points.
Mr. Chair, there is a technical way I discovered. If the bill is laid over, by motion it could be moved on Wednesday to jobs. And then there's no rules then because the body, you needed 41 votes, assuming there would be 41 votes to move this thing, which I can't imagine there would not be. It could happily go to jobs and avoid rules.
Oh.
So if that's your desire.
Senator May Quaid.
I learned that today, Mr. Chair.
Question. Senator May Quaid, are you sure? That's the question, yeah.
Thank you, Mr. Chair. Yes, I would maybe confirm with a few other members across the aisle on this committee that we could have the votes to send it to jobs before making that commitment. But I
got it. No, we're good. I think I like that. I like that idea. Lay it over for possible inclusion, and if we want to, Wednesday, we could do that.
May I say?
Yes, it's your chair, yes.
No, Mr. Chair, you're the chair. I just want to thank you both for being here so much. And Mr. Shelby, you were the soundtrack to every drive home I had from high school all the way till I graduated from college. And I'm so deeply appreciative of all your work and so grateful that 46 years ago you had an opportunity to get off the bus uptown because there were a lot of things happening between, I was high school 2000 to 2008, I was in college, and there were a lot of things happening, and I turned to you every day when I was driving home to learn more. So probably sitting here in part because of you, so thank you.
Thank you very much.
So, do you remember top of the IDS?
Oh, yes.
WLOL.
Oh, yeah.
So I married Kelly Fox from WLOL 99.5, who spent a lot of time in Uptown. Yeah, so I appreciate that. And you wanted final thoughts there, Mr. Selby, or Senator Abeler? And
well, I would be surprised if we couldn't get this moved, but to have it move Wednesday we have to get the motion to the desk midday on Tuesday.
All right, I think we just keep it with us there. Glenn, you had your opinion on this? Stay here?
Well, I'm flexible on that, whatever you think works best.
Okay.
Could this be a bonding issue too?
Yeah, I think it meets everything. It meets our jurisdiction, it meets Wickland's jurisdiction. It could be a bonding request jurisdiction one,
Well, I'm just saying,
absolutely.
everything's tight financially, we don't have targets. I'm just saying if we can't find the money for this, then maybe a request to the bonding committee to consider it would be
I
appropriate.
like that idea. We should talk to, this is North Minneapolis, right? Who's the senator that represents North Minneapolis? Wasn't he some Grammy nominated, was he Grammy nominated?
Yeah, that guy.
Something, 1994, 2001, some band, Excelsior Choir or something, isn't that it, Bobby? I like that idea, Glenn. That's actually, okay, we got a couple of options. I hope you're hearing that, Al Flowers. There's a couple of options that this committee found for you, man. So, Mr. Selby, last words, and then we got to go to Senator Abeler's bill.
Yes, so this would be directed to Senator Gruenhagen. So Senator, because I sat through this hearing and I heard some of your comments on the other people who testified. I don't know if you know my background, but I spent 60 years of my life as a professional investigative journalist, right? And a lot of that was financial crime. And before I accepted a board position, and certainly before I accepted the position of board chair, I did a full background on Turning Point because I wanted to make sure it was squeaky clean, because I agree with you, it is an embarrassment to have the kind of fraud that has happened in this state. But I want to assure you that you will not find any, because I did not find any. And I went over there with a fine-tooth comb. You will not find anything in the 50 years of service this Turning Point has done for this community in this state. I just want to assure you, nothing of the kind.
Senator Gruenhagen.
Just real quick, thank you for that comment, Don. And no, one of the reasons I probably have hit fraud more than anybody else in this community.
Really?
Yeah. Is because, you know, like the housing area that the governor put a halt on because of fraud. And yet I saw on the news people who really needed those services. So when we have fraud, the unfortunate thing is, number one, we lose federal funds are froze. Number two, the people that really need the help lose it. And that's the ones I'm concerned about. That's why I continually hammer it and say, let's cooperate with the federal government where we can so we don't lose funding, so we can help the people who really need it. And thank you for checking out the organization. I appreciate that. And thanks for what you did. And by the way, I did jail ministry for 13 years. I wasn't in jail, I did jail ministry. So
And guess what? He was also on the school board for 16 years. You forgot that one, Glenn. All right, Senator Abeler, come up. Mr. Selby, thank you very much. Thank you, Ms. Wilson. Thank you so much for the work that you do. Absolutely. We're going to lay this over for possible inclusion. Thank you, everybody.
Thank you to all of the members. Thank you very much.
You know, he should do our segue voiceover work to, you know, for our committee as we're waiting. You know, we could have that. Still got that $1 million voice, doesn't he, Glenn? There you go. Senator Abeler.
Well, Mr. Chair, it would be presumptuous to say we've saved the best for last. We've saved at least an amazing thing for last. If you recall, what year was that? Oh, is that the picture?
Yeah.
It was right here when you were chair. Yes.
Yeah, so I was thinking to bring it back. We spent the whole session with Jake's picture on my computer. And we first met. We were having SUD day, and Ms. Lanart was testifying, and I have to admit, you weren't the first testimony, and like, okay, and if you notice as a chair, you kind of sit there and listen, and okay, and not that it'd be a blank stare, Mr. Chair, I would never have done that, but then suddenly this picture shows up, and I was just shocked into attention, and that moment changed me, and so let's let her go. So this is a proposal for an amazing project. Thank you.
Thank you. Yes.
Hi, Pam. Welcome back to the committee.
Yeah, thank you, Senator Abeler and Chairman Hoffman and members of the committee. My name is Pam Lanhart. I serve as the Executive Director for Thrive Family Recovery Resources, and I want to give testimony this afternoon. And it's interesting that we're following the people at Turning Point, because what we do in a nutshell is serve the families of those individuals that go to Turning Point, that go to, treatment programs that don't get treatment. People like Holly, who's sitting back in the third row, who might not have the opportunity to get help any other way, who came to Thrive because her son was overdosing, was at risk for death, and needed support for her family. So Thrive is a certified recovery community organization in Minnesota, and all we do is work specifically with helping family members who are impacted by substance use. We take a family-first approach, providing much-needed services to these families. Since 2021, Thrive has assisted thousands of families with culturally responsive, evidence-based programming. We provide barrier-free access for one-on-one family peer services, psychosocial education, assistance with navigating systems of care, and stigma reduction, which helps families respond to addiction, treating their loved one with integrity and honor and unconditional positive regard. These services are not billable either by private insurance or by Medicaid. So they are not available at the treatment programs in Minnesota, but Thrive bridges that gap. In 2022, we received a Department of Human Services grant to develop these family peer service model because it didn't exist in Minnesota. Despite a shortened implementation timeline, we significantly exceeded our deliverables. This appropriations would restore critical programming so that we can stabilize our organization and meet the demands of the families to the level that we were at in 2024 when we executed that grant successfully. According to the CDC, when one person dies, it costs our society $11 million. Thrive's work prevents death. The reality in Minnesota is that people are still dying from substance use. But when families are supported, positive outcomes double. Families stabilize and recovery becomes probable. When families get well, communities get healthier, which leads to a stronger Minnesota. Without these services at Thrive, because we are the only organization in Minnesota that does this, families will once again be left alone in crisis, and the consequences of that isolation will lead to increased deaths. The picture that you see is my son, Jake. It's why we do this work. When Jake was 12, he started using substances. In those early years, we called his pediatrician, our pastors, county crisis, the police, anyone that would listen, and there was no help for us. His addiction escalated, and despite multiple treatment experiences and recovery for a short period of time, we lost Jake to an overdose at the age of 24 in 2021. Now, I can't help wonder that if there would have been an organization like Thrive, perhaps with this early intervention, Jake would still be alive. I can't change that outcome, but what I can do today is ensure that these services will be readily available for any family that needs them, so that we don't have to lose any more individuals to overdose because their families could not find the help and support that they needed. You have the power to ensure that we are able to continue this life-saving work. Thank you for your time and consideration.
Thank you so much, and thank you for sharing about your son, Jake. May his memory be a blessing. Mr. Clubb, please introduce yourself for the record. Welcome to the committee. You may begin.
Thank you. Good afternoon, Chairman Hoffman. I'm so grateful to see you in that chair and members of the committee. My name is Joe Clubb, and I serve as the Vice President of Mental Health and Addiction, and I have led mental health and addiction programs for the last 21 years. More importantly, I'm here today as a father. I'm the father to Noah, one of 7 children who my wife and I adopted. He is 29 years old and he struggles with the meth addiction and has struggled since he was 19 years old. I'm really grateful for the opportunity to speak to you today and on behalf of Thrive. 3 years ago, after Noah had left the state, we returned him to the state of Minnesota. In those past 3 years, he cycled through 6 treatment programs, and his mother and I attended several family education sessions. There's so many times that you can learn about the impact of addiction on the brain. We needed more. We attended our share of Narconon groups, and we learned that the best thing that we could do for Noah was to let him hit rock bottom. We needed more. We needed help, we needed tools, and we needed hope. I was then invited to join the Thrive Board of Directors. It was there that I began to hear something different. One day, Pam mentioned that I might want to attend a couple of workshops, Ann and I have been doing that, and possibly attend a Thrive support group we've been attending for the last year and a half. First started online and now meet weekly in person. Through Thrive, I learned that I could love my son, but still create healthy boundaries. That natural consequences were okay. His chaos did not need to be mine. I can still remain connected and love him, and we as a family can remain safe. What a difference a year can make. 1 year ago, Noah was out on the street in active use. Our family was feeling hopeless. Ann and I waited for that dreaded phone call that many parents fear. We were actually able to welcome Noah back into our home with healthy parameters. After 1 year of working with Thrive, and as a family, we are creating a new relationship with Noah. I'm happy to report Noah is gainfully employed with benefits and insurance. He moved into his own apartment, and the other day showed me his view of the state capitol from his apartment window. He's maintained loving relationships, and we as a family have created a new course. Because of Thrive, Noah stopped cycling through treatment. He has chosen to be actively engaged in therapy. Because of Thrive as a family, we're having many more good days. Because of Thrive, I got my son back. With the transitions from treatment to the community, there is a gap. Thrive fills that gap. Addiction, as we all know, is a family disease. Thrive is a recovery organization that brings the family together. Thrive is the only certified recovery community organization in Minnesota focused specifically on families who are impacted by family members and loved ones suffering from substance abuse. Thank you for considering supporting this work that is saving our son's life and many other people out there struggling with addiction. Thank you for your time and consideration.
Thank you. I love it's the only recovery community for families. I mean, that's what it takes, right? It's inclusiveness. Members, questions for our Senator from Anoka?
Mr. Chair.
Senator.
In closing, thank you. We had a neighbor named Brian who our kids grew up with. He began to use, the parents didn't agree on how to do it, they just didn't know. Brian's not here. And the dad was trying to understand, the mom was staying of a rope and the rock bottom thing, and that just didn't work. I hadn't thought of that till I got here in this chair. Such a wimp. Mr. Chair, so the good we can do sometimes, we don't even know the people. And, Pam has made a real effort to reach out and make a difference from her loss and keep Noah here. I think that's pretty cool. And so, Mr. Chair, finally, her organization's got 3 years of funding as a startup, but then there's no ongoing for this thing because there's no billable services, which is why they're here trying to preserve what they have. So with that, Mr. Chair, I appreciate the consideration of the committee and thank Ms. Lanhart for her work. So thank you, Mr. Chair.
Senator Abeler, thank you. And thank you, Pam, and thank you, Joe. Nice to see you too. And Joe, nice to see you. Senate file, we're going to lay this one over for possible inclusion. Members, Wednesday. Why do they put a D and an N? It's Wednesday.
There's a whole story about that, Mr. Chair.
I know. Liam and Kyle are going to take us through the DE budget and the DE budget spreadsheet for the budget. And that spreadsheet will be posted on Wednesday before the committee. And then we're going to mark up stuff on Friday on the budget bill. Not the integrity, but the budget bill.
Mr. Chair,
Yes, Senator.
will that bill give us knowledge? Thank you.
See, that's good, the same one. But you know, it also dawned on me, Senator Abeler, you had mentioned that Sam leaned over to me and said, 3 years, 3 years setting aside waiver reimagine, it would cost the same, the question is, would cost the same as if you just repeal it and start all over again. And so I circled repealer, and I believe you said that as you're coming by. So members, I think we got a lot of work to do. We just don't have much time to do it here. So look at everything, folks. Make sure stuff is there in the budget bill that we did here, and then we'll mark everything up on Friday. Does that make sense to everybody?
Thank you, yeah, it is a little different.
Budget. With that, we are adjourned. Thank you, everybody, for being here.